Corner update. I'm here with Dr. Malik and we are going to talk about breast cancer. Hi doctor, thank you for joining us.
Thank you for having me.
My first question is, how often and at what age women should consider getting a mammogram, and are there any other ways that young women can get checked?
A mammogram should start at the age of 40 in women who have no significant past medical or family history of breast cancer. If a woman has family history of breast cancer, sometimes we start a little bit earlier, but the standard is at age 40 and to continue it yearly. The cutoff age hasn't been determined, so if a woman is healthy and has no significant comorbidities and medical problems, we continue for a significant period of time. In addition to that, in young women who may have dense breasts, we add on ultrasounds to our screening regimen to help us detect possible lesions.
And how many kinds of breast cancer are there?
There's primarily two main categories of breast cancer. One is called invasive ductal carcinoma, and the other is invasive lobular carcinoma. Ductal carcinoma is more common, about 75% of breast cancers. Lobular carcinoma makes up about 25%. One's not better than the other, they're just different.
Can you talk about improvements, integrated therapies, immunotherapies, and their success rate?
So those are all investigational. There's nothing that's come in the standard guidelines in terms of alternative therapies for breast cancer management. The standard treatment for breast cancer is surgical therapy and systemic therapy, which is comprised of either chemotherapy or hormonal therapy, and then radiation. So the alternatives treatments are being investigated, but there's nothing that's come out to say that it should be incorporated in the standard of care.
Are there any alternative methods that have been successful?
Not that I would recommend.
How has the research helped develop new targeted treatments, and how has this improved survival prognosis?
So there's definitely been a lot of advances, especially in systemic therapy, and when I say that I mean chemotherapy, in terms of the treatment of breast cancer that have improved overall survival. There's a lot of ongoing research to look at tumor biology and tumor genomics to better target therapies, and that has led to a lot of advancements and improved survival.
What about clinical trials?
There's, once again, a lot of clinical trials that are being investigated. Breast cancer is a very curable disease, but we don't have a cure for it yet. So there's definitely a lot of research going on in the field to assess what better treatments we can offer our patients. So the clinical trials are available in the surgical realm, in the systemic therapy, even in radiation. So, we have annual meetings, and every year we have more and more data that's coming out of these clinical trials that are shaping management.
Is genetic testing available to the general population, and who should look into it? Also, how is the risk assessed?
So genetic testing is available. I would not recommend that the general population get tested unless they meet the criteria for testing. There are specific guidelines on individuals who should be tested and who qualify for testing. And they include a woman that's premenopausal in their breast cancer diagnosis, so they have a diagnosis of breast cancer while they're still having their annual monthly menstrual cycle. In addition to that, women who have a strong family history of breast cancer should have genetic testing. Anyone with male breast cancer should have genetic testing, and there's other criteria, but those are the main ones.
What measures should be taken if the risk is high?
If the risk is high, they get the genetic testing, and that's either a blood test or a saliva test to determine if they are a breast cancer gene carrier. Once we determine if they are a carrier, if they are, we do screening, increased screening. There's actually three options that we can do. We can do increased screening with imaging studies and physical exams that are more often, usually about twice a year. In addition to that, we can offer prophylactic medication to decrease the chance of developing cancer. And the third is prophylactic surgery to decrease the lifetime risk of developing breast cancer.
Thank you so much, Dr. Malik. I'm Lucia Dragos. See you next time on Health Corner Update.